There are more than 100 million people in the US alone who have a daily struggle with one type of prosthetic device or another to compensate for missing teeth. They suffer with the discomfort, the inconvenience, the embarrassment, and the changes in facial appearance that are all too common with traditional dentures, bridges, and crowns.
So I fractured a front tooth, I don't know, like 10 years ago in an accident. And I had some root canal, I had a couple of crowns put in. None of them were very successful, I guess, because my dentist told me last year the tooth had to be removed. So I guess I should have done something about it then. But, I was nervous about losing a front tooth, so I put it off. But then it got really painful, and I knew I had to do something.
I've always tried to take care of my teeth, and I've had some work done over the years to keep them. But a few years ago, my dentist told me that I was going to lose these back teeth, and that was really hard to hear.
The doctors of the Dental Implant Institute of Las Vegas, Dr. Jennifer Cha, Dr. LeonChen, and their associates produced this video to answer the many questions you may have concerning dental implants. In this video, you'll discover why dental implants have become the standard of care for replacing teeth that have been lost due to disease, injury, or decay. We'll show you what implants are and how they can become a permanent part of your mouth and your smile. And we'll address many of the most common concerns about dental implants, including your questions about implant predictability and length of treatment. By the end of this video, you'll have an appreciation for the benefits of dental implants, as well as an understanding of why dental implants have become the standard of care for growing numbers of people who are seeking the best solution for tooth replacement and wish to maintain an active, healthy, and carefree lifestyle for years into the future. To understand if you might need a dental implant, it's first important to understand your teeth in relation to your jaw and their dependency on each other. The roots of natural teeth are embedded in the jawbone, providing a stable foundation that allows teeth to function properly. When teeth are lost or extracted, the bone that supported those teeth deteriorates. In addition to physical deterioration of bone as a result of tooth loss, healthy teeth will often shift and change position in the jaw, producing an altered bite. This can lead to muscle strains, headaches, and inability to speak clearly, unease around family, friends, and coworkers, and of course, the loss of your beautiful smile. A dental implant is an artificial root that provides a stable foundation for a replacement crown, the visible part of your tooth. The implant itself is a small, man-made titanium screw that is placed in the bone of the upper or lower jaw. During the healing process, the bone forms a biological bond with the implant, giving your new crown a foundation as permanent as the root of a natural tooth. Artificial teeth are then made and fitted to the anchor of the implant. These implants supported replacement teeth look, feel, and function just like natural teeth. Some patients may be missing a single tooth, while others may be missing several teeth. Implants can be used in a variety of ways, depending on the specific needs. What's most important to remember is that only dental implants can replace the entire tooth, including both the crown and the root. And only dental implants look, feel, and function like your natural teeth. The most common dental implant procedure is the single tooth implant. Replacing an entire tooth was never before possible prior to dental implants.
Dental implants have transformed the face of dentistry. The technology and evolution of implants has changed forever the way we treat common dental problems. But what's most amazing to me is how the science of implant dentistry has made implant the most predictable type of dental treatment for many of our patients.
The technology of utilizing titanium implants in the body has been used in orthopedics for more than 50 years. Titanium implants have been used in dentistry for more than 30 years and have provided a level of predictability, success, and benefits that are unmatched in other areas of medicine. The benefits, in fact, are many. Even a single tooth implant treatment will stop the bone deterioration process, restore your mouth to its natural state, provide a look, feel, and function of natural teeth, not compromise adjacent teeth, increase stability, eliminate the pain of dentures or partials, improve your ability to bite and chew, and improve your appearance. Prior to dental implants, a frequent option for replacing a single tooth or multiple missing teeth was a traditional tooth-supported bridge. This procedure involves grinding adjacent teeth into pegs in preparation for crowns or caps. This permanently alters what is frequently healthy tooth structure. These pegs then provide the foundation for a false tooth, which is connected between the natural teeth. Tooth-supported bridges don't prevent bone deterioration, require the grinding down of healthy teeth, create stress on the remaining teeth, and increase the possibility of root canal problems, the development of tooth decay, and the likelihood of tooth fractures. Rather than a tooth-supported bridge, the new standard of care is an implant-supported restoration, the ideal solution for those situations where single, multiple, or an entire arch of teeth are missing. In this procedure, implants are the anchor for a new restoration that doesn't compromise adjacent teeth. It preserves the bone by replacing the tooth root and provides stable replacement teeth that look, feel, and function like natural teeth.
At first, I had a removable denture. It felt bulky and it never really seemed secure. I'm a pretty active person and my job requires that I do a lot of public speaking. I was always nervous that something embarrassing might happen.
It's a common complaint. Even with well-fitting dentures, the average denture patient experiences frequent slipping and sliding, resulting in slurred speech, clicking noises, and dramatic decreases in chewing ability. But with implant-supported overdentures, there is no slipping and chewing ability is restored. Overdenture implants maintain the integrity of the facial structure, preserving the remaining bone and virtually stopping the deterioration process. They increase comfort, provide solid stability, restore chewing ability, improve facial appearance, and eliminate the need for adhesives. Clearly, dental implants have many benefits over traditional crown replacement procedures. They will improve your appearance, eliminate discomfort, let you speak with confidence, restore your natural eating and chewing habits, and improve your self-esteem. Sometimes, older patients express concern that their age may prevent them from being good candidates for dental implants. Actually, health is more of a determining factor than age. Discuss your current health condition and any medications you are taking with your doctor. If your gums and bone are healthy enough to have a tooth extracted, you are probably healthy enough to receive implants. The best person to determine if you are a good candidate for implants is a qualified implant surgeon. The doctors of the Dental Implant Institute of Las Vegas are diplomats of the International Congress of Oral Implantologists. They are certified in periodontology and are affiliate professors in the implant department of the Harvard University School of Dental Medicine. As the founders of the Dental Implant Institute, we are committed to educating the general public as well as the dental community. Our treatment is geared toward patient-driven, innovative procedures involving less trauma and shorter healing time for a successful case outcome. Dr. Chen has invented specialized techniques that can help you enjoy quality of life with a lot less trauma and discomfort. The Dental Implant Institute's international collaborative relationships with premier dentists have ensured thousands of successful implant procedures worldwide.
A common question that many patients ask is how long will the treatment plan take? We tell them that the treatment plan varies depending on their situation. But with the new advanced bioengineered implant surfaces, implant procedures, and special techniques that have developed regarding sinus graft, treatment plan has been greatly reduced. As a matter of fact, with some of our newest techniques, certain patients can have their new teeth almost immediately. In other cases, a time period can range from 2 to 6 months for healing prior to finishing the restoration in order to achieve the best results. We understand that many patients have questions and may be anxious about implant surgery. We feel, though, that through educating our patients about the process, they experience a level of comfort and confidence because they know what to expect. We also offer a full range of sedation options for patients who desire that additional level of comfort. We make every effort to ensure that patients are able to maintain a normal work schedule during and after the implant procedure. Most of our patients are surprised how simple the process is and how well they feel following the surgery.
When I was 17, I lost my front 7 teeth in a car accident. So I've worn partials or dentures most of my life. Every time I was fit with new dentures or new partials, there was a certain amount of pain or discomfort involved in that process. One day I decided to contact the Dental Implant Institute of Las Vegas after seeing one of their commercials for implants on TV. Implants seemed like the perfect solution for my problem. It made a lot of sense. My first meeting was with Dr. Chen, and after he explained the process to me, I knew I'd come to the right place. Dr. Chen and Dr. Cha, their whole staff seemed so knowledgeable, so friendly, and helpful that I made my decision almost immediately to have the implants done. Well, I couldn't be happier. My implants are everything Dr. Chen and Dr. Cha said they would be. They feel and look exactly like my real teeth. Never in my life have I had a bite like I have now. I can eat anything, even apples. And I'm no longer ashamed of my smile because I no longer have those ugly wires in my mouth. I can't say enough good things about Dr. Chen and Dr. Cha and the entire staff here at Dental Implant Institute. I'm truly grateful for everything they've done for me. I thank them from the bottom of my heart.
Every day, more and more people are discovering that dental implants are the best solution for replacing teeth and restoring smiles.
This is a very exciting time in the field of implant dentistry, and it's so rewarding to be part of a profession that can have such an impact on a person's life. At the Dental Implant Institute, we place the emphasis on both the surgical as well as restorative aspect of each individual case. It's this attention to details from the start of the case to its completion that makes it possible to achieve exceptional results for our patients.
Reduced treatment times, minimal discomfort, and life-changing results. Dental implants truly are becoming the standard of care for tooth replacement. The Dental Implant Institute of Las Vegas takes a team approach with all dental implant procedures to guarantee that every patient receives the information, the attention, and the skills to ensure the most successful outcome possible. Every treatment situation presents unique conditions that can affect the longevity of a dental implant. The titanium in dental implants is biocompatible, which means that the body doesn't recognize the implant as a foreign material, so rejection is not a concern. With favorable healing and proper care, most patients can expect their dental implants to be a lifelong replacement for their lost teeth. And extensive clinical research has established that implants have excellent long-term success rates of more than 95%. In fact, the first patient received his dental implants more than 30 years ago, and they are still with him today. There are many dental insurance plans available today. Some plans include coverage for implant services, while some do not. Your insurance coverage, however, should just be one consideration in your decision to proceed with dental implants. Other factors you should consider include improved appearance, comfort, convenience, and confidence. Dental implants are not just for the rich and famous. They are now the standard of care for anyone who values their health and their quality of life.
I don't know what I was so afraid of. I mean, it was so much easier than I imagined. After all those years of dealing with that broken tooth, this new implant is like the strongest tooth in my mouth. I should have done this years ago.
The biggest change since my implants is that I've got my self-confidence back. I used to worry about my teeth all the time, but now days go by where I don't even think about them. The truth is, my implants make me feel younger.
To schedule a consultation as the first step toward experiencing the life-changing effects of dental implants, please call Dr. Jennifer Cha or Dr. LeonChen, or visit the Dental Implant Institute website at www.diilv.com.